I didn't realize this comes with housekeeping services. Thanks, Jeff. So Dave just told me, I think most of you know Dave Osendorf, he just told me that he translated some of those numbers to Jeff at Beer 30. So it's actually 80% membership growth, not 18, for the record. So Jeff, you should take even a bigger bow than you have. So look, when I listened to you describe the process that the ESC went through to choose the decision to move forward with a high-performance solution and to choose Centivo, all I can hear when you say that is we're the only people crazy enough to say yes. Now, I'm thankful that we were the only ones crazy enough to say yes, because ultimately it's your vision that we said yes to. This is not a Centivo solution. This is a business community solution. It's been authored by this group, by the leadership here, a solution that is rooted in the power of data that showed that not all providers are created equal, that we're not looking to restrict care, but we're looking to raise the bar on what's possible, and pairing the power of the data and those insights with the courage to actually take action against those insights. Those are two words that are rarely used in healthcare purchasing in America: power and courage. But this community, this business community, this provider community, by being willing to think differently and to have honest, transparent, and authentic conversations with doctors, with caregivers, with employees, with family members, the willingness to take that project on is what's led to the results that we've seen so far. And what's so inspiring to me is to be able to come back and to be able to have the conversation of the vision and the ideas of a couple of years ago, and now to see results and to hear stories. And we'll talk through some of those stories, stories of employers, stories of people who just want to come to work every day, do a great job, and not be debilitated by the anxiety of not knowing where to go for care, or not knowing if they're going to choose a clinician that is the right clinician for the care that they need, or worst of all, not being able to afford a bill that shows up in the mail and wondering what expense they're going to scrimp on in order to cover it. Those are the real life challenges that this group and this community is helping to address, and we're proud to be a very, very, very small part of that answer. So being a community solution, the bedrock of it are the providers in the community, 14,000 growing and strong. We're proud to have so many of you in the room with us today, as well as our partners from HPS. And we're proud to see, as Jeff noted, that list growing. This is a testament, I think, to the willingness to challenge status quo thinking that all sides of the equation are not willing to think differently. In fact, they all are. And we've proven that here with the types of provider engagement that's not a one and done. That's an ongoing conversation around improvement in cost and quality through forums such as the joint operating committees that the BHCG has set up. You know, in less than 2 years since launch, we now have 35 employers in this market on this program and growing, literally seeing now multiple new employers joining per week. About 50% of those employers have joined in the last 6 months. The two things that make me most proud of this list, sample list of logos, the first is that if we were to literally open a business museum dedicated to industry here in Wisconsin, is there an iconic brand? Maybe one, Harley-Davidson. But is there more than one iconic brand missing? Probably not. The depth of organizations who are committed to this community, several of whom are family-owned, and have said that it is our duty, our responsibility to not just lower cost, but to improve quality, is special. It's not something that's happening around the country, but it is happening here. The second is, if you look at that list, we span organizations together that are Fortune 500, Fortune 100, all the way to organizations with 25 employees. This is not a solution that's restricted or limited to the healthcare elite who can access anything and everything. This is built for everybody. And you see it in the types of organizations joining and the types of benefit advisors, brokers, consultants, many of whom are in this room, who are helping their clients see new ways of operating through the BHCG program, including for their small and mid-sized clients. So how do we get to that level of results and the momentum? Jeff mentioned this briefly in terms of the up-down chart. Good care up, bad care down. This is a different way of looking at it, and I'll just focus on sort of the two ends of the spectrum. Ultimately, there's ways to reduce costs, there's ways to change various attributes of how we manage healthcare, but the only way to do it sustainably is to move how that actual care is consumed. The 3 C's, changing care consumption. And so what you see here in terms of the top performer compared to what typically happens on a fragmented, uncoordinated, scattered, broad PPO type solution is double the amount of spend on primary care. Actually looking at that as good spend, looking at it as an investment, not an expense, and seeing that that drives dollar for dollar reduction in other types of care that are really important, as long as it's appropriate and not overused. And we're going to hear briefly from Lisa and our physician colleagues about the power of primary care and how that is the bedrock of the BHCG High Performance Program. Deeper than just more spend on primary care is the right spend on primary care. So one of the hallmark insights of the physician value study is that if all of the care in the community were shepherded by the top performing primary care teams, that would lead to a 40% reduction in cost. Now, shepherding all of the care through those clinicians is hard to do because access is always a challenge. But what we're proud to be able to say today is that of the care going through this program, 20 months in, 94% of it goes through those clinicians that were rated as top performing by the physician value study sponsored by the Business Healthcare Group. And the cost differences are staggering when you look at the high-performing group versus everybody else. So it's not just more money to primary care, it's getting the right types of care into the right types of clinicians, which is what we need to do as a society if we actually want medical school graduates and future generations embracing primary care as where they can actually make a livelihood in medicine. Again, where you're voting with your dollars is driving those decisions, and you're doing the right things here in Eastern Wisconsin. So we shared some of this earlier. What I would point out is the member cost. We showed some big changes in member cost, even with HSA qualified plans. So one of the things that we as an organization have introduced first in this market and have said it's such a good idea, let's do it elsewhere. So I hope you don't mind that we're stealing some of your ideas. But we are now introducing guided high-performance health savings account qualified plans in other places. We started that work here in Wisconsin, even with a high deductible, even with a deductible that meets the requirements to be health savings account qualified, 21% reduction in member out-of-pocket cost. So that's the affordability imperative that's being driven by the work that you've done. Jeff mentioned this client, that consultant in the room. Thank you, John, for your support. So this is a client that already had been on a journey to improve their plan. And this is not a client of 100,000 employees with all kinds of scale and purchasing power. This is a classic middle of the fairway employer that represents this business community. Had been on an independent TPA, had already looked at pharmacy strategies, and 2 years in has seen costs go down year over year. Here's what I like to say when I hear those stories. There will be a year in which this organization's costs will go up. People get sick. People need care. That's why we have the infrastructure that we do. That's why we're proud that even though costs have historically been high in this community, quality has been high as well. But what this savings allows this employer and other employers in this community to do is now be better prepared for that rainy day when inevitably there will be a high cost event. It's that type of forward thinking that again is being led here in southeastern Wisconsin. Now, I won't read all of these quotes, but it's been famously said that all you have to do is follow the money if you want to know what's going on in healthcare. Well, if you ask the typical employee, their family, the typical member on a plan, pretty quickly, follow the money. What employees are looking for is affordability, predictability, and simplicity. And we, all of us who've worked in this industry, whether you're a purchaser, a provider, a vendor, all of us have made the error of creating incredible complexity and then buying solutions with the hope that that would somehow remove the complexity, whether it's a navigator, a data tool. And what you're seeing with some of these quotes are real-life people basically saying, now that I am being organized through an experience where I know that the care is going to be of high quality because the data defines it, and that there's a primary care team looking out for me, as long as I follow those two simple rules, I can afford my care again. And that's the key piece that we hear over and over, that what employees are looking for, whether it's through this program or any other program, keep it simple, and let me not be anxious about how I might have to pay a bill. So before we close out here, I think you're going to hear a lot of other anecdotes today from the clinical side, where I'm so proud to have an opportunity to hear from Wendell Potter, someone I've been following for a long time. But the other crisis in this country beyond affordability is access. And there's a lot of reasons for that, and I'm sure we'll talk about it a little bit on the panel that we have coming up. But one of the things that we've done, again, in partnership with you, is the ability to integrate digital and other modalities into creating access. And the most fascinating part of what we've seen through this is we can often stereotype that there's a certain type of person that's going to use a virtual care type solution. And maybe that's a young person, maybe it's a millennial, maybe it's someone who's staring at their phone all day. Well, the reality is what we're actually finding is some pretty complex situations that want their care managed in a different way. And so this is an example of a Wisconsin employee who had a high fever. It came off of oral surgery, assumed that it was a complication from oral surgery. Actually, it turned out to be an undiagnosed tick-borne illness. Not only was that diagnosed virtually, but the care was coordinated in such a way that all of the relevant inputs were brought together by consulting with the oral surgeon and other members of the clinical team. It speaks to where we can take this for the future. We are and should feel privileged that we live in a country that's constantly trying to push the envelope on innovation. There will be high-cost drugs. There will be new technologies. There will be things that will continue to put pressure on cost. But as long as we keep thinking about how we drive towards quality and access, we can actually do that at a price that we can afford. So the bottom line is, it is our privilege to be a partner with you in this endeavor. I know we're just getting started. There's a lot of work to do, but congratulations on the last 20 years and look forward to a great next 20. Thank you.